This is All India Radio. In the program Spotlight, now we bring you a discussion on Prime Minister's interaction with Chief Ministers. The participants are Sandeep Phukan, political analyst, and Neelab Srivastav, journalist.
Prime Minister Narendra Modi today held the second part of interaction with chief ministers of various states. To be precise, 14 states like Delhi, Maharashtra, Gujarat, Uttar Pradesh, Bihar, Madhya Pradesh and few others, one union territory of Jammu Kashmir. The thrust, again, as we had discussed yesterday, Mr. Phukan, was about slowly moving the wheels of the economy. This was the review of the COVID situation in the country. The first meeting was held yesterday. We had discussed about it. This was the second and the last meeting. The Prime Minister, one very important takeaway after this meeting was that he said that we need to battle and we need to fight the rumors of another set of lockdowns coming in, and also that we are going towards unlock 2. That is what categorical statement that the Prime Minister made. Now, why did he say this? I will just put some figures in perspective. As of today morning data, we have seen a highest ever spike of over 2,000 fatalities or deaths. That is largely because of the Maharashtra and Delhi adding some part of deaths that were not attributed to COVID-19 disease earlier. So as of today, we have over about 3.54 lakh cases in the country, out of which about over 1.55 lakh are active cases. We also have recoveries of about 1.86 lakh, and the recovery rate now in India is about over 52%. The entire data, keeping in perspective, because we are getting numbers more than 10,000 for the last 4 or 5 days now, since we have entered into unlock 1, 2 weeks into it. Mr. Phukan, Prime Minister very categorically saying that this is going to be unlock 2, economy has to move and we are working towards that. And these states are very important because maximum caseload is coming from them. Your views on that?
I think, as you rightly said, that the biggest takeaway from this meeting was that Prime Minister Narendra Modi very categorically saying that there is a need to fight rumors of another lockdown. Now, why did he say that? Simply because in today's time, when it becomes very difficult to ascertain what is real news and what is fake news, you would recall that few days back on several social media platforms, there was news being circulated that the centre may impose another lockdown post June 15th because the numbers have spiked. That is clearly not going to be the case. I think that's fairly clear from Prime Minister Modi's virtual video conference with chief ministers. And mind you, these are states that have seen some of the highest cases, whether it's Maharashtra, whether it's Delhi, West Bengal, Gujarat, Tamil Nadu. These are states with a fairly high number of cases. And yet, when the Prime Minister says this, it's fairly clear that the government is now confident about two things. One, that the recovery rate is very good and it gives the confidence to the government they could handle the situation even if the cases go up. Two, the health infrastructure that was required to be ramped up has now reached a level where there is adequate isolation facilities or oxygen facilities, quarantine facilities. So all these facilities have come up to a level where if there is a spike in the number of cases, the government can handle it. So these are two things that would play on the mind of the government while taking a decision. And as I said, that the backdrop of the statement is that there was a lot of rumors because of the recent spike in cases. The central government once again announced a nationwide lockdown. So I think Prime Minister made it very clear that there is a need to fight rumors, and we are now well on our way to opening up the economy. And the term used is Unlock 2.0. So it's quite clear that more things are going to be opened up post June 30th when Unlock 1 formally comes to an end.
More things going to be opened, as you rightly said. The Prime Minister, in his own observations, he did say that the spread of this coronavirus is hugely seen in certain big states and cities where the density of population is more. It is difficult to maintain physical distancing. A lot of activity has begun. People are now moving from one place to the other, going to the work, coming back. But he again reiterated the very fact that the discipline of the people of the country has also been exceptional. We have been able to contain these numbers from whatever they could have been. The other very important point that he mentioned now was that how do we go ahead from here, especially talking in the context of these states where you said the caseload is very heavy. So he says that existing testing capacity needs to be ramped up, the healthcare has to be enhanced, the facilities need to be ramped up. So please tell our listeners about how and what is going to be the strategy of the states and the central government vis-a-vis healthcare management.
Most of these states, whether it was Maharashtra or Gujarat, West Bengal, Delhi, all of them briefed the Prime Minister about what the individual states have done to increase their facilities. Prime Minister on his own said that states where there is more use of the Arogya Setu app. They have done better in terms of tracing and tracking positive cases. He encouraged the state to further encourage citizens to download the app and use that app more and more. Also, he very categorically said that the mantra should be trace, track and isolate. We have moved from complete lockdown or complete shutdown mode to now a situation where we have acknowledged that the virus is going to stay for a while. We have to live with the virus. We have to live safely. We have to protect lives, but we also have to protect livelihood. The economy cannot be permanently in a shutdown mode, so it has to be opened up. As you rightly said, when economic activity increases, while the government will keep stressing on the need for social distancing norms, wearing of masks, staggered timings for offices, encourage work from home and all these issues. But there would still be cases because people went out, people may acquire infection. So what do you do then? So the mantra should be test, test and test. Once you test, whoever tests positive, you isolate them, you track their acquaintances, whoever they have met. Instead of chasing the virus, you could perhaps be ahead of the virus by testing, tracking and isolating COVID-positive patients. So I think that was something that Prime Minister impressed upon the state. He also impressed upon chief ministers the efficacy of the Arogya Setu app and how it has helped states where there has been better use of this app.
One of the important points, this is very unfortunate when we stigmatize a disease. The Prime Minister had a special word on this. He says that we need to battle the fear and stigma of contracting COVID or anywhere when we get to hear that there is a COVID-19 case or a coronavirus case. That stigmatization of the disease needs to be taken away, and this has to be countered by the very bright side of this disease, of this pandemic, is that there are a good number of people who are recovering. As of today, the data is that in India, over 1.86 lakh people have recovered. So that is also one area that needs to be addressed. And there he also mentioned about Jan Bhagidari and the support towards the frontline corona warriors, as we call them.
Absolutely, Nela. I think this virus is completely new. It has taken the world by surprise. Nobody really knew about it, let alone common people. Even experts really are trying to find out cure, its remedy, vaccine, causes, why it spreads so fast and so on. So it's natural that common citizens have a sense of fear. And many of them may think that if you get corona, maybe it's irreversible condition, maybe you will never recover, you don't know how to deal with it. There is a lot of trauma, there is a lot of stress. And also, especially in urban areas where you stay in gated societies, if occupants of one flat becomes corona positive, then it so happens that the entire complex gets sealed. So others also have to stay indoors, and that sort of accentuates the sense of stigmatization that because of X family or Y family, the entire society is now being sealed. Given these conditions, I think it is very important that the government keeps disseminating this information that corona is, of course, a new virus. Still scientific research is being done and vaccine is yet to come out. Yes, it could be like any other viral infection. It need not necessarily be life-threatening. Having said this, of course, we've lost a huge number of people to this disease. So at no point of time, any person can take it lightly. You have to keep your guard very high. But it is something that can be cured. And I think the numbers speak for themselves, isn't it? I mean, if you have 52%, which means that if 10 people are infected, more than 5 people have recovered and they're back home and they're leading normal lives. That point needs to be stressed again and again.
One of the specific discussions that happened during this meeting today was the talk about the economy again. We've been talking in the initial part also that the wheels of the economy have to move. During the yesterday's meeting, the Prime Minister talked about the green shoots in the economy, which are now probably looking visible. We're going towards the pre-corona days when everything was working and moving at an unusual pace. And today he mentioned that with the reduction in restrictions, the indicators of economic performance are now showing some signs of revival, and the states are now required to boost infrastructure, probably also give thrust areas in different construction-related works. Also, Philip, to the MSMEs, the Finance Ministry had announced a special package for the medium, small such enterprises and the farming and the agriculture marketing. So the thrust on the economic part, Mr. Phukan, remains.
Absolutely. Prime Minister had talked about green shoots in the economy yesterday. He talked about how consumption of power, which is a very important indicator, had gone up. Toll collection had gone up, thereby meaning that interstate movement of goods have picked up again. He mentioned about the sowing of Kharif going up by 12 to 13%. So some of the indicators were mentioned yesterday. Some of them have been mentioned again. Agriculture is expected to play a very key role. We've just had almost a bumper procurement of the Rabi crop. Though there was a delay because of the lockdown, but eventually states have done well. Many of the states actually tweaked the rules and started picking up from the villages themselves. So procurement has also picked up towards the middle of April. So some of the green shoots have come up, but the challenge, as I said, that protecting lives as well as protecting livelihoods. Now, you need to turn the wheels of the economy, but at the same time, you also have to ensure that while doing so, you are not reckless and you just don't give away the gains that you had because of the lockdown. Most certainly in a populous country like ours, the mortality rate is quite a big learning lesson for the rest of the world. And even if the cases have spiked up, still, I think it's well under control. So I think that is the key challenge for the government, that how do you open up the economy, at the same time protect lives and gradually open up the economy so that livelihoods are also protected.
He also talked about, the Prime Minister did mention, the Chief Minister during the meeting also mentioned about the ground situation in their various states as to what indicators they are getting, the kind of health and infrastructure they are putting on ground they already have. And in this context, the Prime Minister mentioned about the manufacturing capabilities within the country of the personal protective equipment, we call it the PPEs, the masks, the availability of diagnostic kits, the availability of beds for isolation, for critical care. So, Mr. Phukan, going ahead, because we are now getting huge numbers because of the activity now resuming, and we may further now looking forward to Unlock 2. What situation that we see in populous cities like Delhi and Bombay, where ensuring beds for critical patients or for normal patients is also a very challenging area. So I think the Chief Ministers and the PM now are working towards that to ensure that these cases, we are now receiving a lot of spurt in these cases, we are able to address them.
So you already see a lot of change in strategy, Dilav, in terms of how the states are handling these cases. From a time when even like the moment you test positive, you're taken to an isolation ward and hospitals, putting pressure to the health facilities. What we see already now is that many states, even if a person tests positive, they take a call in terms of symptoms. If a person wants to home quarantine with mild symptoms, even that is allowed. And other non-conventional infrastructures are being built for isolation centers and as treatment facilities. Just to cite an example, in Delhi, a banquet hall has been converted as a quarantine center, as an isolation center. So if somebody who tests positive and has mild symptoms and may not require ventilator support, so he or she can be accommodated in such a facility. On the other hand, requirement of health equipment, as it has gone up, the supply has also gone up. You mentioned about, Prime Minister mentioning this quite clearly. If you recall, when COVID struck in a big way in India, there was a massive short supply of personal protection equipment. There was a shortage of face masks. And you would recall that an N95 mask would cost 250 or above. Today you get them for 80 rupees or so because the supply has increased tremendously. I think that's the key. With Prime Minister also mentioned that how PM CARES Fund is encouraging manufacture of local ventilators. That's one key area as we go along and open up the economy and expect a spike in the number of cases. Certain cases would always require ventilator support, and availability of ventilators would be a key issue. So locally manufactured ventilator is also being encouraged.
So now that we move forward with these two series of meetings between the Chief Minister and the Prime Minister, it is expected and it is hoped that with the emphasis on the health infrastructure, information systems, the emotional support and public participation, as what the Prime Minister said and the CMs also, it is expected that we move forward from here, go towards Unlock 2 with a better preparation to battle the pandemic of coronavirus. Thank you very much, Mr. Phukan.
Thank you so much.
You were listening to a discussion on Prime Minister's interaction with Chief Ministers. The participants were Sandeep Phukan, political analyst, and Neelab Srivastav, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our website, newsonair.com. You may email your opinion about this program at airnsttalks@gmail.com.